Thank you to all who are uh, watching this tutorial on how to complete Magellan Behavioral Health of Pennsylvania's retrospective review form for our Health Choices recipients. I'm going to provide a once-over on how to complete the form in full and ensure it's submitted so that Magellan can assist you with your requests. The first thing to do is to go to the Magellan Behavioral Health of Pennsylvania website, which is magellanofpa.com, and you'll land on this page. This is the member-facing page, though, so you'll want to go to the provider page. So at the top right, click for providers, and the provider-facing page will open. The form is under Provider Resources and Forms, so hover to Provider Resources, click that, and you'll get a drop-down for the available areas. We're going to go to Forms so we can get to the retrospective review form. And all the relevant Magellan forms are listed here alphabetically, and we can roll down to the request for a retrospective review near the bottom of the first section. And once you click that link, you'll have the option to open it. This is a PDF that can be completed, so there's form fields that can be entered. And you'll know you're in the right place if you have the Magellan Behavioral Health of Pennsylvania retrospective review form header. Now, a retrospective review, again, is a evaluation of medical necessity of treatment services that is being requested after the treatment has been rendered without authorization. So this is for situations where, for reasons outside of your control, you are not able to request prior authorization for the service for which you now need coverage. Again, Magellan cannot make payment to out-of-network providers who are not enrolled in Pennsylvania medical assistance, and for substance abuse out-of-state providers, we can only consider inpatient services, the ASAM level 4 and above. Okay. Again, the entire form must be completed in full to be considered. Incomplete forms and requests, we're not going to be able to process those. So let's envision a member who received inpatient care and you need to request a retrospective review because you weren't able to connect with Magellan ahead of time to request prior authorization. Again, the form can be completed right here online. And let's say John Doe. Next, we need the member's medical assistance ID, preferably with the 3-digit county suffix. If you don't know it, that's okay. We can just take the medical assistance number. If you need our county prefixes, they're pretty much in line with the member's county of eligibility. Bucks is BUC. Cambria is CAN, Delaware is DEL, Lehigh is LEH, Montgomery is MNT, and Northampton is NOH. So let's say we have a Bucks County resident who received care, and you have their ID number. Next, we want to choose the member's county of eligibility, and that's available in drop-downs for you. In this case, we'll choose Bucks County. Next is the date that you're submitting the request to Magellan, and we have a calendar drop-down available, so you can pick today's date if that's the date you're doing the work. Next, you'll enter your agency's name. Let's say it's County Hospital. And you want to know your Magellan provider identification number, also known as the MIS number. That's a 9-digit number. And we're going to presume this request is for an in-network provider, but if out-of-network, there's an opportunity to share your medical assistance ID number and or your tax identification number, the address for where services were provided, and then contact information so we can connect with you to collect any information needed for authorization and billing and contracting purposes. Now we'll roll down to the services that were in question, and each area has drop downs for all of the services that are covered benefits. So in this case, we have 24-hour levels of care for mental health and substance use. We'll say for our situation here, we're looking at a mental health inpatient stay, procedure code 0124. And we'll say the member was in care from February 1st. There's also drop downs if you prefer for all date fields. And let's say they were discharged on February 5th, meaning 4 days of service were provided. Again, there's areas for all of the other services that we offer. Community-based. In this case, that was auto-filled. You want to lose that. And we also have a section for community-based substance use care. Again, all of the available benefits are listed there, all in drop-downs. But again, for this scenario, we'll envision a member who needs coverage for inpatient care. All right, now we are at the section where you choose the basis for which you're requesting retrospective coverage. Again, as noted in the provider manual, we will only consider requests for the following reasons: emergency services. So if services provided in the course of an emergency, we can consider coverage. If a member's eligibility is retroactive, we can consider coverage. If a member received services that were believed to be covered by their primary insurer, and it turns out they were not covered, we can consider coverage. And also expedited enrollment. So for members that are newly eligible, we can offer a 2 business day grace period and go back 2 days to cover care. In this case, let's say member John Doe was believed to have been covered by a primary insurer during the dates of service. So we can check that reason. To include with your form, this is guidelines for information that needs to be submitted so we can consider medical necessity. So for example, the social worker notes for each day of an inpatient stay, the physician and nursing notes, any formal evaluations, so that could be a psychiatric evaluation or psychological evaluation, a discharge summary if the member has left the level of care for which you're seeking coverage, and for substance use services, we'll need the ASAM summary for admission and discharge for each level of care. Next, we want to offer just a brief summary of care, basis for the request, and course of treatment. This does not need to be a very long narrative, but we do want a quick summary of what services were provided and why you need the retrospective review. So in this case, we'll offer that the member was admitted to the hospital on February 1st due to thoughts of self-harm with a plan. At admission, the member presented a Blue Cross card and appeared eligible with that plan, but when they billed Blue Cross, that coverage ended up having terminated on January 31st. The member received medication adjustments, participated in daily group and individual counseling. By February 4th, the member was no longer reporting thoughts of self-harm and contracted for safety. Discharged on February 5th with aftercare arranged at county counseling. Relevant records and a copy of the Blue Cross denial of payment notice are enclosed. So again, a brief summary of the course of treatment and why the retrospective is needed. So once you have the form completed, again, this is a form that can be saved as an electronic document, or if you'd like to print it right from this page, you can choose the print option. So once the form is completed in a form that you can send it to us, you want to send that along with the information and records to us at 888-656-2380. If for whatever reason it's unable to be faxed, you can contact us at your provider line, and we can research alternate ways for you to submit the form to us. Again, if there's any questions, feel free to contact Magellan, and we'll help with the form. Thank you.